Hello, I am Dr. Lawrence Smith, Dean of the Donald and Barbara Zucker School of Medicine at Hofstra Northwell. Thank you for tuning in to Well Said. In a culture of community, scholarship, and innovation, the Zucker School of Medicine is dedicated to transforming students into doctors who will improve healthcare, inspire change, and better the lives of the people they serve. It is why we are pleased to collaborate with WRHU Radio Hofstra University to bring you a program committed to sharing expert discussion and insight on health and wellness topics important to you. Join us today and each week for a recommended dose of Well Said with your host, Dr. Ira Nash.
Hello, I'm Dr. Ira Nash. Welcome to Well Said. Today we'll be discussing meditation and we'll explore the potential impact of meditation on your mind, mood, and overall health. My guest is my colleague, Deborah McElligott. She is a nurse practitioner in Northwell Health Center for Wellness and Integrative Medicine, which is part of the Katz Institute for Women's Health. She is also a clinical assistant professor at the Zucker School of Medicine and is a certified integrative health and wellness coach. Deb, welcome to Well Said.
Thank you so much, Dr. Nash. I'm so happy to be here.
So let's start with how you're doing. It's been an extraordinary, I was going to say year and a half, but it's been even longer than that. As somebody devoted to mental and physical wellness, how have you been holding up?
That's like a loaded question. I think I've been holding up pretty good. You know, like everyone else, the world's changed dramatically, and it's really changed my work practice. I'm used to being with people in person, hands-on, with a lot of integrative modalities. Never thought I would like the virtual platform, and we've really seen expansion and so many increased opportunities and the ability to reach people on this virtual level that I never would have anticipated 2 years ago. So that's been exciting.
So I want to get started, and there's lots for us to talk about, but I want to start at least talking about meditation, and I'd like you to define exactly what meditation is in the context of your work, and how does meditation differ from other mental practices like general mindfulness and other things that our listeners may be familiar with?
Okay, great. And those are really buzzwords that we hear now all over the place. It seems everybody's talking about meditation. When I try to define it, I usually go to the NIH website and I look at the National Center for Complementary and Alternative Medicine, and they talk about meditation as a group of techniques. Most started in Eastern traditions thousands of years ago, where people learn to focus their mind, focus their attention, and stop that stream of thought that occurs, almost constantly in our mind. So this practice, it's thought to really help people in terms of greater physical relaxation, mental calmness, and help to balance us. Mindfulness and meditation are often used interchangeably, but, there's slight differences between the two. Meditation is usually the formal practice that can calm the mind and enhance our awareness of ourselves. Mindfulness simply means being aware in the present moment. But mindfulness has been really popular in our country, especially with all the work that Dr. Jon Kabat-Zinn has done. He really brought mindfulness to the forefront. And he describes it as being aware in the present moment, paying attention on purpose, but non-judgmentally. So very different than us thinking every day. I think of something and I judge it. This is right, this is wrong, they're right, they're wrong. Mindfulness is just being aware and not judging it. And that gives us many different benefits. I guess that became so popular because he's really done a lot of work with mindfulness and created his mindfulness-based stress reduction programs and seeing great benefits in people learning this technique after an 8-week period.
I hope we get to talk a little bit about those benefits, but I want to go back to meditation. So you said that was a focused kind of concentration designed to quiet the mind. Is that fair to say?
It is, and there's so many different types of meditative practices. It can really be confusing for people.
Can you run through a couple of those for us?
Sure. I think I first became aware of the word meditation in the 1960s, not to date myself, but, when they had the transcendental meditation and the Beatles were meditating. And in this tradition, it's an intense practice, and someone's giving a mantra, that's a word or a sound, and that becomes the focus of their meditation. So that's an intensive program, and that can be costly, but that's one type of meditation. Then there's meditations where people just sit and be, and that's the mindfulness. You sit, you set your alarm for 5 minutes or so, and you just notice what comes into your mind. You acknowledge it, You don't judge it. You let it go, and you bring your awareness back to your breath. So you're being present, and you're just noticing what's going on. And then there's focus meditations where you deliberately focus on something, such as the loving kindness meditations or meditations from heart math, where it's heart-focused breathing. And you focus on the feeling of love or gratitude, and you send that feeling to yourself and to others. There's body scan meditations where you sit and you notice and bring awareness to your head, to your eyes, to your mouth, to different parts of your body. And then guided imagery even falls into meditation, where you focus on your breath, you become relaxed, you imagine something positive. You use the mind to focus on the power of positive thoughts as opposed to the worry. It's often called the lazy man's meditation. And then we have the moving meditations, such as the yoga, the tai chi, qigong, where you're focused on simple movements, coordinating it with the breath. And Then finally, but not last, we have prayer. Prayer is a form of meditation. Some of the statements are that, when you pray, you ask God or a greater being for something, and when you meditate, you listen. So these are going on across all cultures for thousands of years and really been ingrained in many cultures. Suddenly we have the need to, study it and recognize it and realize the benefits, which is, to me, always exciting when something old becomes something new and something everybody wants to learn. And probably if we asked our grandparents, they did some form of this.
So that's interesting. You mentioned that these have been around for a very long time in different forms. And I suspect that's because they provide some benefit to the people who practice them. So what are some of the potential benefits that one of these meditative practices can provide?
Usually the first benefit that somebody notices is that they feel relaxed after meditation. They lose a sense of time and a sense of urgency. Sometimes I usually say I do, New York meditations with people I work with because everyone's in a hurry, everybody's multitasking. And sometimes after meditating for 3 to 5 minutes, people will be like, I feel like, I had my eyes closed for a half hour. How long was it? So we often lose sense of time, and people very often feel relaxed. Now, that's not everybody, It's a challenge sometimes to learn a new habit. I find it easy with the moving meditations, like the Tai Chi Easy is a practice that we do at our center. It's an hour-long practice, and it includes meditation, mindfulness, movement, and some self-massage. And sometimes for people that can't sit still, just standing in a correct position where the energy can flow freely and your arms and legs aren't crossed, and you're comfortable, and moving arms with the inhale, the exhale, moving the legs with the inhale or the exhale. After standing and doing that for a half hour or so, people often feel very relaxed. And then they get it. They get what the sense of relaxation is, which I think is really important in our society. I think so many people don't know what it feels like to be relaxed.
What about benefits beyond that subjective sense of just feeling less pressured in your life? Are there other things that people can expect to derive from dedicated practice?
Sure, depending on how much you want to be studied. I mean, there's a number of functional MRIs that they've done on people before they meditate and after they finish an 8-week program, and they can actually see changes in the gray matter of the brain, beneficial changes in the people who meditate. They also see changes in the part of the brain where we recognize fear, and they see that area decrease. So on a very cellular level, we're seeing changes related to meditation. That heart-focused meditation that I mentioned, there's a company called HeartMath that's done a lot of research on that area, and they have little devices you can put on your finger that measures your heart rate variability, that beat-to-beat interval, not the EKG, but what we call the heart rate variability, and it's the heart-brain coherence. They can prove by little graphs while you're looking at it how when you're focusing on feeling that feeling of gratitude, your heart rate variability changes. So the goal is to recognize this and to see how we can sustain it, to develop practices where we can have these benefits during the practice, but not only during them. The studies show that when you stop meditating, you still have that benefits throughout the day.
And that benefit can be measured more easily than some of those fancy tests that you're talking about, right? I mean,
definitely. I mean, we've done simple things. When I was working in a cardiology office, somebody would come in all sorts of stressed. You take their blood pressure, it's sky high. you do a 5-minute meditation with them, and by the time the provider walks in to take their blood pressure again, it's normalized. So we can see some very simple changes very quickly. We know that if you start to run, the heart beats faster. We know that if you start to think about something that stresses you, your heart can beat faster, you can start breathing faster. So the same way, when you meditate and you control the breath, you can decrease the heart rate, you can decrease the blood pressure. You can decrease all the negative things and improve all the positive parts of the stress response.
And to your point, those persist, right? It's not just like right as you're meditating, but people's blood pressure in general can go down and stay down if they're regular meditators. Is that correct?
Yes, they can with a regular practice. A 5-minute meditation, there's no quick fix. A 5-minute meditation isn't going to cure your life, but persistent practice has real benefits. When we look at the stress response and we see how people age, we see how even things like bone density, how your mental fatigue, how your endurance, how your resilience can decrease over time. And we know that these practices, which should be part of any self-care routine, can really slow down the aging process. And not just the aging process, but build resilience in anyone, which is so important in these times.
This sounds wonderful. How much meditation do you have to do to get some of these more persistent effects? So let's say to lower your blood pressure and keep it down, how much of this do you have to engage in?
I usually ask people to start with 5 minutes a day and then build up. The interesting thing is that if you have a formal practice, 5, 10, 15 minutes a day, it almost like opens up the door to other practices. Then you may say, well, that felt really good, sitting and being aware and reflecting. And then you become more mindful when you eat. So if you're mindful when you eat, you're not going to be eating everything inside. You're going to choose foods that help you feel healthy. You're going to chew the food. You're not going to multitask while you're eating. So you'll incorporate more mindful moments into the day. It's like, with the whole field of neuroplasticity, we can teach an old dog new tricks. We can reawaken different aspects of the brain. We can change a negative attitude from all the stress and negativity out there, and we can start to seek, positive experiences. And this all forms together. I think it's a really exciting time.
Yeah, this reminds me a little bit of some of the frustration that people who are trying to lose weight sometimes feel that it's very difficult to lose weight, so they get frustrated because they're not losing weight quickly. It sounds like this is a little different, where you can actually get appreciable benefit from a pretty small investment that can then grow over time.
I think that's true. And, it must be true because the statistics are really increasing in terms of the use of U.S. adults in meditation. Now, there were 4% of adults who admitted to meditating on one survey that NIH did in 2012. That grew to 14% in 2017, and I'm sure it's way higher at this time because our center's really been a source of information for so many people. We have so many more requests in the area of meditation, self-care, yoga, Pilates, Reiki, the integrative therapies, because people realize, when we talk about integrative health, we don't say you meditate and don't take your medications. We talk about, using the best of science of our conventional medicine, using some 1,000-year-old practices, but another whole focus is self-care and how important that is. So we give people options of many different ways to meditate and to include some of this mindfulness in their life.
How do you suggest that somebody who's interested in this get started? Where do you start and how do you start?
I'd love to just have a conversation with the person and first ask them what's their experience. I've had people that I've been in contact with, patients specifically in the hospital, saying, do you do anything to relax? Do you do any meditation? And this one lady said, oh, no, I don't do any meditation. And then as we're talking, she's like, oh, but I read my prayer book every day and I say a rosary in the morning and at night. So sometimes people don't realize what they're doing involves meditation or mindfulness, as sometimes they're used interchangeably. If someone's a painter, very often, that's a form of mindfulness. Fishing can be a form of mindfulness. Walking out in nature, standing for 15 minutes watching the sunset, those are all forms of mindfulness that can, then lead to more of a meditative practice. So I usually ask where people are and what they may enjoy. And if it's a person who says, I just can't stand to sit still, I would usually start working with them with either a moving meditation or a meditation that involves hands on the body, either holding a finger and counting while you meditate, or placing the hands on the belly, the mid area, the chest while you meditate. There's a lot of different techniques. And some people, I'll be guiding through a meditation, and they'll say, okay, you can stop talking. I'm there. Just let me be. So everybody's different. There's no one size fits all, but there's definitely something for everyone.
That's really very interesting. But I wonder if there are people who you think are likely to be particularly benefited by engaging in meditation. But what sorts of folks do you think really ought to be meditating?
Well, certainly someone that's stressed, that can't relax, that has challenges sleeping, that has a lot of the high blood pressure, the high blood sugars, the rapid heart rate, someone that has challenges making decisions. I mean, it really can benefit anybody. There have been a lot of studies done on athletes with post-traumatic brain trauma, how important meditation can be in healing that. So, I mean, children, seniors, it's funny. One presentation I was showing a meditation, a finger hold, and I said, you can use this with anybody from, 5 to 95. And this one lady raised her hand and she said, I'm 96. Is it okay if I do this? So, it's out there, and people are out there, and we can't judge people by their age. We can't judge people by their skin color or the way they look. You don't know what people like until we have the conversations with them. And we guide them, and a lot for many people that have been brought up in different cultures and religions, there's a lot of ritual that helps them to meditate, either in a certain place, a certain sound, certain music, a certain scent. So these are conversations that we have when people are trying to find what's right for them. And then, simple things are join a class, take a yoga class, take a Tai Chi Easy class, see what it's like doing this even virtually in the comfort of your own home, and see if it resonates with you. And if it does, great. And if it doesn't, have a conversation with someone and see, what needs to be tweaked to make it right for you.
And what about the use of some of these techniques for very specific medical conditions? I'm thinking of people, say, with chronic pain or inflammatory bowel disease or specific anxiety disorders. Is there a role for this kind of practice as part of their overall treatment plan?
Definitely from the literature I see, and definitely from my personal experience, although I have to say it's very hard to have the double-blind randomized controlled trials that are the state of art for recommending something. But usually the comment that people make, the experience that they have are very beneficial, because if you think of someone in pain, if you think of someone who's anxious or someone with irritable bowel disease, when they're stressed, their symptoms are usually heightened. So if you can get them to relax just a little bit, often their symptoms subside a little. But it's not a cure. It's not like someone has really bad pain and they meditate for 5 minutes a day and they have no pain. But often people will say to me that they still have the pain, but they can function with it, or they feel different, or it's there, but they can cope with it. So it changes sometimes not the pain number if you're measuring it, but the perception of pain and the ability to move. That's another great thing. We always say motion is lotion, and as you do some of this simple yoga, whether it's chair yoga, whether it's mat yoga, whether it's very movement-oriented or a restorative yoga practice, people feel the benefit of it, and people are moving, which is really important as we want to stay healthy.
Well, yeah, I really like what you said about these mental practices, not necessarily changing the biology of the disease, although I think they can do some of that, but helping people to cope with their illness and through that become less disabled. I think that's incredibly valuable.
It really puts them in control. Very often you can't control your pain. You can't control anxiety at times and irritable bowel. People feel they have no sense of control, and meditation, guided imagery, mindfulness, these are things they can do for themselves. It's interesting, guided imagery, where we would talk somebody through relaxing, imagining himself in some special place that's just perfect to heal and be comfortable. We have a number of free links on our website for that. And people will often say that it's the lazy man's meditation, because you don't have to do anything. You put on the script and you listen to it.
Right, right.
And if people fall asleep, their subconscious is listening to it, as opposed to listening to the news or listening to people argue or things like that.
Well, that's interesting. I think a lot of us have sort of a special place, family vacation location, or a place from our childhood where it's just associated with happy memories. And I know I do this from time to time, just imagine myself at that place. I never thought of that as meditation, but I guess it is a form of meditation.
It is, because often, I work a lot with people one-on-one that have severe pain or end of life, challenging diagnoses, and the imagery can be very powerful. And that's not something you have to do every day with a practitioner, but sometimes you do it once or twice. You sort of solidify that place or the color or the smell, and then that's something that you call on as needed. And sometimes people get a different perspective on what they're dealing with. It can change because, again, you're going deep within. There's a large premise that, each one of us knows what it is we really need to help ourselves heal. Hence the whole world of coaching, to help people discover their own inner wisdom. And sometimes imagery is the key. It's like that bridge between the conscious and the subconscious, where we get the answers that we need. So it's powerful stuff. Very hard to measure and get the studies from, but yet really powerful when we use these methods working with our patients and our staff.
Is there any known downside to this, any disadvantage of engaging in these activities?
I usually say if people have some mental health issues, this is something you discuss with your provider and decide what type of meditation or imagery is best for you. There's specific imagery that works well with post-traumatic stress disorders. Some of the moving meditations work better with psychosis and schizophrenia than sending somebody to a special place. So if you have mental health issues, I would say check with your provider. If you're someone who has a very low heart rate and you don't have a pacemaker, you don't need to relax more, but that's sort of a joke. We used to say that in the hospital, you don't relax people that are ready to pass out. But most everybody can benefit from relaxation at some point.
Yeah, interesting. As we're talking about things like yoga and meditation, I suspect that many of our listeners may associate some of these practices, frankly, with affluence, with people who have means. And I wonder what your thoughts are on the accessibility of these practices to patients who might be struggling to access, what I'll call conventional health care because of their socioeconomic status or because of their economic circumstances.
I think meditation is the least expensive of any therapy. Many cultures and religions, as we mentioned, have been doing it for thousands of years. You don't need a lot of training. You certainly can. You could spend thousands of dollars or hundreds of dollars and get your own personal instructor, receive your own mantra, take an 8-week program, but you need to do it. I've spent thousands of dollars over the years taking a number of different meditation trainings and programs and certifications, but they don't work unless you do it. On our website, if people have internet access, we have YouTube videos of meditation that's free. We have free links for guided imagery for stress. We have free links for guided imagery to prepare for surgery and for healing from cancer. So you don't need to spend a lot of money. This is something you need to do yourself. And many communities offer this. Many high schools offer different types of meditation. Faith-based communities often have programs, senior centers. We do presentations, in many different areas. And again, check out our website. There are many free apps for meditation that people have been using. You just have to read the fine print and make sure that you're not going past the introductory offer, or you don't click on the premium edition of it. But again, I'd say to people, if you're thinking of starting this and you've never done it before and you have medical issues, talk to your provider about it, or give us a call at the center, and we'd be happy to guide people through beginning a practice if they have any specific questions.
Deb, you've mentioned your website a couple of times. Could you give that URL to our listeners?
The Northwell Center for Wellness and Integrative Medicine, so it's www.northwellswim.com. So that's the shortened version of it. They could even call our center if they wanted to, 516-858-3095.
Why don't you give that again?
516-858-3095.
You've mentioned a bunch of resources, both through your center and elsewhere. Are there other kind of high-quality sources of information that you would recommend people seek out if they're curious about what's out there and want to just explore their options?
Definitely. I would go to the website of Heart Math. It's www.heart, H-E-A-R-T, math, M-A-T-H.org. And that has free meditations on gratitude meditations. And then the company that we use for our guided imagery that's been used pretty much nationally for the last 20 years is called Health Journeys. So you could Google them as well. And they have a number of different guided meditations that you could pay for, probably $11 or $12 to download it onto your phone. Or for the ones that we have, you can simply go to our website for free. But those are two really good companies. If someone's looking to become certified in mindfulness-based stress reduction, Dr. John Kabat-Zinn has his mindfulness program. We also offer one-day trainings in imagery and meditation, and we'll probably be doing an extended one next year, just to give people skills that people that want to use it, or I should say providers that want to use it with their patients, or people that want to use it with their children. But there are a lot of very simple techniques that can be used. So I encourage people to experiment. Even when you're sitting at a red light, you can't really meditate for long, but you can take a couple of breaths and just notice what it feels like, to relax as opposed to being stressed, counting how long the light is.
Yeah, and when I got to say, driving these days requires some meditation because it's kind of crazy out there. So good advice.
It is. It really can be crazy. There was a really nice quote from someone from the Royal College of Surgeons in Dublin, and they said, the crisis such as COVID-19 pandemic has shown that change is the only constant. And meditation and mindfulness can offer a helpful way to live with this constant change.
I think that's a wonderful place to end it. I want to thank you so much for joining me today.
Okay, well, thank you for having me.
My guest has been Deborah McElligott. She is a nurse practitioner in Northwell Health Center for Wellness and Integrative Medicine. She's also a clinical assistant professor at the Zucker School of Medicine and a certified integrative health and wellness coach. For more information about this program and to find past episodes, please visit sites.hofstra.edu/wellsaid. You can also subscribe to our free podcast available on Apple Podcasts, Stitcher, or wherever you get your podcasts. Our listeners are welcome to send comments, suggestions, and questions to wellsaid@hofstra.edu. Until next time, I'm Dr. Ira Nash, and that's Well Said.